Hello, parents, and welcome to our virtual pediatric campfire chat, brought to you by CRISTA-Run Healthcare. As pediatricians and parents ourselves, we created this series to open a dialogue to provide education and answers on a variety of topics we know have been weighing on your minds throughout the COVID-19 pandemic. Your CRISTA-Run pediatrician is a trusted advisor during these difficult times. So sit back, get cozy, and get ready to chat. Just wanted to briefly give folks an overview, and then we're going to get into the content of our episode today. So, I like to kick off these sessions, if you've been on with us before, with kind of a state of where we are in the Orange, Rockland, and Sullivan County area where we have our practice. And as many of you know, we've been in a sort of a fortunate situation locally where we've at least made it to the other side of the initial surge of COVID activity in the region. However, I think all of us are cautiously watching what's going on in the rest of the country and concerned that we may have a resurgence of cases locally again. In the area, we're in phase 3 still in terms of reopening. So a lot of businesses have reopened. Camps actually started this past week to reopen. We talked about that on a prior episode. And some sports have been allowed to come back. During this time, we've been open. We've been taking care of patients. And we've missed you. We've noticed, and not just here at CRISTA-Run, but across the country, a significant decline in vaccines and well child care. And one of the things we're going to talk today about is office safety. The last thing I just wanted to mention is that, in terms of just the local cases, we've had over 20,000 tests done at CRISTA-Run, and we've had, especially in Orange and Rockland counties, a significant number of cases in the 12 to 14,000 number. Over the last month, the cases have gone down. They're not down to zero yet. We're seeing anywhere in each county between 5 and 15 new cases a day. And we've gotten to this point thanks to the hard work of all of you, the difficult time of being home and being careful. And I think all of us are very anxious to kind of get out and do things differently. But I think one of the messages of tonight's show is to how to do that safely, because it's certainly not the situation where we've kind of put this behind us. So with that being said, I'm going to have Dr. Henry start things off. Talk to us a little bit about what we're doing at CRISTA-Run to maintain the safety of our patients when they come to visit us in the office. I know some parents and some of our patients have been concerned about coming into a doctor's office during this time. So Dr. Henry, can you fill us in on kind of how we're handling that and how we're seeing patients and our children during the course of the last few months and moving forward?
Okay, can you hear me?
I can, yeah.
Okay. All right, so in order to keep you safe here at CRISTA-Run, we have implemented a few policies. Number one, we screen every patient for coronavirus symptoms. That might sound something like, have you experienced any fever, cough, runny nose, vomiting, sore throat, diarrhea in the last 14 days? Okay, so we do that before, when you make an appointment, and we do that before you enter into the office. We have implemented a no waiting room policy. So your car is your waiting room. And you come into the office directly into the waiting room to be seen by the doctor. Also, before you come in, we ask that you bring the child that is being seen or children being seen with one parent. We also ask that everyone wear a facial mask except for children less than 2 years of age for risk of suffocation for them. We also have implemented a policy in which all of our staff have to wear face masks. For doctors and nurses and medical assistants, we have to wear the surgical mask. As for the other staff within the office, they can wear either a surgical mask or a cloth mask. We are also, as employees, all screened, self-screening for COVID symptoms daily. We are asked the same questions that you are asked. Have we experienced any of those symptoms within the last 14 days? If your child has a fever, cough, runny nose, sore throat, don't fret. We have a place for you. We have designated sites in which you can be seen. We have also increased our cleaning within the office. It is very frequent so that we can protect you. If you do not feel comfortable still at this time, we have telehealth visits that are readily available, and we are willing to see you in any way that you need. Thank you.
That's great. So, Dr. Henry, tell us a little bit more about the telehealth visits. What types of visits lend themselves well to that? Even now, as we've noticed that more people are coming to see us in the office, at least over the last several weeks. But I think we're still seeing a really good role for telehealth. What are some of the sort of cases that you've used telehealth for that you think work really well?
Okay, so I have used telehealth for rashes, pink eye, asthma visits, ADHD follow-ups, any medication refill, pretty much. So anything that we need to actually physically do an exam, like checking an ear, unfortunately cannot be done on telehealth because we cannot see within the ear. But anything that we can have visualization is a good visit for the telehealth.
Great. One other change that happened this week, I'm just wondering if you could comment on, is that the state, New York State now, and actually a number of the sort of northeastern states have started to implement a required, although not enforced, quarantine if folks are coming to us from another state that has high cases. And I think now we're up to 14 states that are affected. What are we doing anything at Crystal Run that might be screening for people coming from a high risk area?
Yes, when we have the appointments for the children, we do ask the parents, have you traveled? And now we have to ask for not only international travel, we have to ask them about national travel now, because we have, I do believe it's 14 to 16 states in the United States which have high incidence of COVID. Yeah. So it's very important that we ask you these questions, and please don't get upset with us, because you're going to be asked that question several times by front desk staff, by medical assistants, and then I'm going to come in and ask you that as well.
One of the ways just to try to keep it as simple as possible, because I think we do know that our patients are getting asked a lot of questions and it may seem overwhelming, but we're just asking folks now, have you been instructed for any reason to be under home quarantine? The number of states that are affected has obviously, it seems to be changing quickly, and so we're just sort of simply asking about it that way. Dr. Henry, we got a question from one of the viewers, and it kind of goes into our next topic, which is, how can we keep safe as we go out into the community? And this has been a topic we've covered on some of the other shows, but one of the questions was about swimming pools. So in terms of, just to answer the question was, is it safe to go to a swimming pool? And this person specifically was talking about a private pool. But tell us a little bit about that. Can you go over to a friend's house to go swimming in a pool? And what other things at this point in time, what precautions can parents take with their kids to make sure that they're keeping as safe as possible as they go out into the community and try to sort of get out of the house a little bit?
Okay, so if you're going to a public pool, I'm going to start with that one first. You can go out to a public pool, but we have to practice the same things that we've been doing all along. So we have to social distance, even though we're in the pool. So that is important. So you have to also monitor your children. They cannot be unsupervised, because even though we're looking out for catching the virus, we also have to think about drowning. Drowning is the leading cause of injury, death in children 1 to 4 years of age. So it is safe if you are social distancing to go to a public pool. Now, for home pools, we suggest that a home pool is fenced in. It has to have 4 sides of the pool with a fence, and the height of the fence should be 4 feet. It should have a slam lock and it should be placed high so that the children cannot reach it. The fence should also be open from the inside of the pool and pushed outward. That way it would protect the child. Now, can you go out with other friends? Well, if you have monitored the activities of those families and you know that they have followed the same rules that you have been following with the social distancing, washing your hands, not going out unless you really have to, then that would be okay.
In terms of doing that with friends, is that indoors, outdoors, with
Oh,
masks, without masks?
okay.
What are some general rules for
Okay.
parents to be thinking about?
Yes, that we try to keep everything outdoors because there's less of a risk when you're outdoors versus indoor. So outdoor activities are the best.
Yeah, I think one of the things that that I've noticed is that the way that at least I've been thinking about it, outdoors with social distancing is the safest.
Yes.
Outdoors with social distancing, there's been some controversy about whether you need to have a mask on if you're outdoors and keeping distanced. The answer to that is probably no.
No.
But I think the challenge is you don't always know, especially with children, if you're going to be breaking down sort of the 6-foot mark, which we're all thinking about. So I think if there's any concern, then wearing a mask outside makes sense, especially if you're out in a public place where people are. If you're at a friend's that you know that has been safe, you certainly can consider being outside without a mask on. But again, the safest thing is to be outdoors, socially distanced, and if not socially distanced outdoors, to be wearing a mask. And then I think coming indoors raises an additional concern with risk.
Yes.
At least that's the way I've been kind of thinking about it as families have been asking me.
Yeah.
Dr. Henry, one question came in. So we've talked about this a little bit, and just as a teaser, in 2 weeks, we're going to be specifically talking about sports with Dr. Conway. So that'll be our show 2 weeks from today. But one of the questions that came in was, what about returning to competitive swim practice outdoors? And is that something that would be safe to resume?
Yes, I think that would be safe to resume. Again, it's outdoors. You're going to be socially distant from the other competitors. So I think that is something that is needed. Swimming is very good exercise, and our children need exercise. They need to be outdoors. They need to have some type of social interactions with others. It's very important for their development and their well-being.
Yeah, and I think just to add on that too, I think what the science tells us is that you can't catch coronavirus from the water. And there seems to be, and again, one of the things that's challenging for all of us is we're trying to give best information to parents in a time where we don't have all of the typical science that we're used to. And I think it's frustrating for some when the science seems to be changing in opinion over time. A good example of that is masks. But the current opinion is that the surface concern and in terms of catching COVID by touching something that someone else touched, and also getting it from, say, the water, seems to be less of a concern. And the biggest risk of being outside swimming is being next to somebody who in terms of breaking down the distancing, because obviously we can't swim with masks on. So great. And then one other question that we've heard about, and maybe you could give some comment on, is what about some other things outdoors like playgrounds? I know that some of the playgrounds have actually started to open. Some aren't yet. But what about playgrounds in terms of just, is that a safe place to take kids?
Okay. So if you're going to take children out to the playground, you have to think about the time. You don't want to go when it's very crowded. So you may want to go early in the day or later in the evening. You still want to bring your sanitizer because you want to make sure you continue to wash your children's hands. Now, for me, I'm a little OCD, so I probably would bring Lysol so I can spray the slide. So we just have to be, and we must definitely be distant from the others. It's really hard with children because children love each other and they come close within each other. So if you do go out, if it's a community park, maybe you know some of the families in that area and you know they've been doing the same things that you do, so you won't be so worried about your child contracting the virus. Just like I said before, I think it is extremely important for our children to have some social interactions with other children. I think that's something that they've been missing for the last 3 to 4 months. And I hope this is not detrimental to them in the future. So I think it's important. We must get our children out. If you are close with other families and you know they are doing the same thing that you're doing, let them play together. Let
Great.
them go and socialize.
Great. And I think one of the things too about that, Dr. Henry, and feel free to comment too, is a lot of that also depends on the current cases locally. So, I think the risk of being outside with a friend is different if there are an abundance of cases like there were 6 to 8 weeks ago. So just to put it in perspective, at one point we had a 40% positive testing rate in terms of people being infected with COVID that came in for testing. And over the last month, we're down at around 1%. So a good way for, I think, all of us to be thinking about the risk of these outdoor or indoor activities, it relates to what the current state of disease is in the community. And again, thanks to the hard work of many of you, we're in a place now where that's a little bit safer. So, okay, great. Now, I know one of the other things that that you wanted to talk about today, and I think that I know in knowing you, and I haven't worked with you for that long, but I think your comments earlier were similar to this, that you do talk a lot with families about safety in terms of just injury prevention and not related to COVID. So I know one of the things that you had wanted to talk about today was just the 4th of July coming up. We do obviously see at times injuries related to 4th of July activities, and give us some of your best recommendations for families when thinking about navigating through the 4th of July.
Okay, so fireworks are by families maybe known to be safe, but that is a false statement. They are not safe for children at all. These fireworks cause the ERs to be full during the month of July. There are 180 people that visit the ED every single day in just the month of July. Therefore, the National Safety Council has said that the July 4th holiday is the most dangerous holiday ever.
Wow.
So fireworks, especially sparklers. Sparklers are the worst thing you can give to children. And a lot of children, especially those less than 5 years of age, are given sparklers. And those sparklers can burn up to 1,000 degrees Fahrenheit. 1,000 degrees Fahrenheit can burn metal. So imagine if that touches your child, that would cause a 3rd-degree burn. So other fireworks, they can lead to severe burns, they can lead to blindness, they can lead to hearing problems, amputation of limbs, and even death. So the best thing for parents to do is actually to take your child to a community event. Now I know this is COVID year, so many of those are canceled. So what we can do, Macy's, and I'm just gonna say Macy's because a lot of the local ones have been canceled. Macy's is doing 6 fireworks shows all the way up to the July 4th holiday. They are not announcing where the location is because they do not want people to congregate. So if you follow that, they will announce it on the day. And then what you can do, you can either watch it on TV, that might be a little bit boring, but that's my type of thing I would do. Or you can drive your car and you can watch it from your car. So if you are at one of these community firework shows, you want to make sure that you distance yourself at least 500 feet from the launching of these fireworks. So other things that you can do, you can wear earplugs for children greater than 7 years old and also adults. But remember, we have our children less than 7 years old all the way down to infants. So earmuffs can be worn by children all the way down to 6 weeks of age. And if it becomes a little bit too much for your child and they're really frightened, you have to be prepared to leave. So if you do go to one of these community events, it may be quite a bit of people. So we need to make sure that we still social distance, wear our masks, and we need to make sure that our children are safe. If your child happens to get separated from you, you may have a discussion with them before going out about how they would handle that situation. So I would teach my child how to find a police officer or a security guard to ask them for help. And also, if it's an older child, you can tell them a meeting point when you get to the park and say, if we get separated, this is where we're going to meet. Okay, so that's pretty much what I wanted to say. The AAP prohibits the sale of fireworks for home use by either mail or internet orders. The AAP says family with children should not purchase home fireworks, but go to community events. The AAP stands for American Academy of Pediatrics, by the way. Sorry about that.
Great. You know, what's interesting about that, thank you, that was a lot of information. And I think what struck me is that most people, I think, feel that sparklers are like the alternative to fireworks and buying firecrackers and bottle rockets and all the other stuff. So that sparklers are probably the most common thing that families have, and especially the younger children. So that was really good advice about that.
Yeah, and they, instead of doing a sparkler, they can wave a flag. They can get the lighted bracelets or the lighted sticks. Yep. And that would be so much safer for them. We don't want our children to suffer. Another thing that fireworks can do, especially those sparklers, it can lead to problems with vision and blindness. So we don't want to put our children at risk for that. They should never be given fireworks. They are not safe at all.
Okay, great. So just for those on the webinar, just to remind you that I didn't mention this at the beginning, but if you do have a question, you can submit that in our Q&A or chat box at the bottom, and we'll be happy to answer those here. One other question that we got before today, though, it feels like we've been home with our kids for a year, but summer actually just started. But we actually got a question about school. And so the question was, will schools be reopening in the fall? And so, Dr. Henry, I just was wondering what you've heard about schools reopening, and whether or not parents should be making plans for continuing with distance learning or looking forward to having their kids returning to school in September.
Okay, so the American Academy of Pediatrics actually put out a statement in favor of sending children back to school inside the classroom. I do agree with that as long as the cases continue to be at the rate they are now. If we have an increase in cases, I would not feel comfortable sending my child in. Just like I said before, I'm going to go back to the same points. It is very important for our children to have socialization. It is very important for their development and their well-being.
Great. Yeah, and I think it's because there's been such a rapid change over the last 3 weeks, at least outside of this area. I think it's really too early to predict what will happen in September. But I do know that that most schools are talking about what their plans are, and I think for our college age students, most colleges have issued a plan to return to school in September. That they've discussed with families. I've heard from some families. The college I went to sent something out that I was given the ability to review, and so they're all planning for it. And I think those plans may be impacted by what's going on with cases, and hopefully things will settle down to the point that we can welcome students back to their schools, whether it be their local elementary school or high school, or if they're going away to school, that there's some ability to do that again. So stay tuned on that. Thanks, Dr. Henry, for the early information, but not that we're wishing away the summer, but that it will be here certainly before we know it. So
exactly.
we'll continue to bring that back to you guys as parents as we start to hear more. We did get another question. So the question is that there has been, or I've read some conflicting information from the CDC and the AAP regarding 6 feet of social distancing or 3 feet of social distancing in a classroom setting. So Dr. Andy, I don't know if you have any thoughts on that and want to speak to it. I think another example where the science may not be perfect yet, but what are your thoughts about the distancing required in the classroom?
Yes, so just like I said, with children, it is hard to really keep them far apart from each other. So I would say the greater distance is better than having the 3 feet distance, because we're going to have children coming in within their space anyway. So I think it's important that we do make that accommodation so that the children are safer.
Yeah, and I think that that's coupled, that's just one part of it. So when if schools return, there will be distancing measures in place in the classroom, but there will also be careful screening, temperature checking, clinical screening, etc. So the distancing is just one part of an overall strategy. And I think the challenge will be that, if there is a case in the school, I think that will be the hard part. I think we can all get behind like a plan of safety, but the challenge will be what to do when there are some positive cases. I'm not sure if that question, I haven't actually seen the specific discrepancy on the 3 feet versus 6 feet with regards to the AAP and the CDC, but it is true that the World Health Organization is using a 3 foot number and the CDC is using a 6 foot number, and our best information that we utilize here in the US is the CDC, and the 6 foot distancing has been what's been implemented in the New York State reopening plan for businesses and camps. And so at least as far as I'm aware, given that the question came in, I'll certainly go back and see what I can find. But the 6 foot standard has been what has been required for the businesses to reopen. It is certainly what we're striving for at Crystal Run, where we can. Obviously, direct patient care doesn't always allow that, which is why we're also wearing masks and doing other clinical screening. But that may be where that difference has come from, but we'll be happy to go back, and I can get back in touch with the person who submitted the question. All right, well, I don't think we have any other questions. So we covered a lot of stuff today. So Dr. Henry, I'd like to end the show, the weekly show, with giving you an opportunity, and I know you had a special message that you wanted to give, but also to give you an opportunity to give your best recommendations for families about maintaining their wellness as we move forward.
Okay, so for all families, I think we should just follow the general rules that we've been following all along. We need to keep our hands clean. We wash our hands with water and soap for at least 20 seconds. And if we don't have soap, we can use a hand sanitizer. We need to wear a mask when we're outside. And we definitely should not touch our eyes, nose, or mouths. Also, just like we just said, we're to continue to keep the 6 feet distance. I think that is pretty much the rule that we all should follow. We have decreased the transmission of this virus before, and we can keep it this way as long as we continue to follow those rules. So I actually wanted to address some of the Spanish-speaking patients at Crystal Run. So I'm just gonna say just the same thing I just said in English to the Spanish-speaking patients in Spanish, with a little introduction of myself. Me llamo Doctora Henry, doctora de pediátrica de 100 Crystal Run. Tiene 2.5 años para Crystal Run. Tiene 18 años para pediátrica. Hoy tiene discusión para COVID-19, no mucho tiempo ahora, pero cuando en oficina tu doctora explique más para COVID. Número 1, lavarse las manos muchas veces al día para 20 segundos. No tiene agua y jabón, necesito usar desinfección las manos. Número 2, no toque tus ojos, nariz, la boca. Número 3, necesito máscara afuera. Número 4, 6 pies de distancia. Cuídate. Feliz 4 de julio. Adios. Everybody be safe. Thank you for listening today.
That's great, Dr. Henry. Thank you so much. So I'm biased, but Dr. Henry is an amazing physician and one of the people that makes our Crystal Run group one that I'm really proud of. And so you can find Dr. Henry at our 100 location in Middletown, and really a amazing amount of information that she shared about both herself and about staying safe during this time. And as I said in the beginning, you know, we really do miss you. We think that we know that we can provide safe care for you. We do, all of us really strongly believe that it is still really important to come in for your well child care. That often happens in the summer. It is a time to regroup on how the school year went, go over some health issues and questions that may be happening, and prepare for a successful school year coming up. And so we encourage you all to contact us, and we're here for you. We're ready to do that safely. If you have a specific question about your child, ask your pediatrician. Reach out to Dr. Henry or to Dr. Hill or myself. We're here for you. We're available. We're happy to do a telehealth visit if that lends itself well to your concerns. And then lastly, thanks again for joining. Hope everyone has a safe and happy 4th of July. We're back again next week with a show on behavioral health concerns, anxiety, depression, and some of those things that have kind of raised their head and created increased cases during this time period. And I'll be joined next week by Dr. Lynn Reminar and Dr. Ame Khan. So we hope to see you then next Thursday at 5. And then we have one last show on sports, which is the following week with Dr. Conway, and we hope to see you then as well. So hope everyone has a great night. Thank you again, Dr. Hill, Dr. Henry. Sorry, Dr. Hill had some technical issues, but maybe we'll circle back with him again on a future show. Thanks again, Dr. Henry. Good night, everybody.
Thank you. Good night. Adios.